For those of you that have already joined our webinar, thank you for joining. We'll be starting in a few minutes. We're just waiting for a few others to log on. Thank you for joining our webinar. We will be starting in a few more minutes. We're still waiting for a few others to join. Thank you for joining our webinar. We are just waiting for a few more folks to log in, and we should be starting in a few minutes. Hello, everyone. Thank you for attending today's webinar. While the webinar is in process, everyone will be in listen mode. Questions will be answered at the end of the presentation. You can submit your questions using the question window on the right-hand side of your screen. Everyone who's signed up for this webinar will be emailed a recording and a PowerPoint of today's presentation. Thank you to today's webinar for coming to today's webinar, Leadership in Crisis, Staying Calm and Setting a Course in the Storm, a CIO story of managing COVID-19. As I just mentioned earlier, for those of you that would like to submit questions, you may use the question window that's located on the right-hand side of your screen. EMT Apps, we're a healthcare information technology services company that work with hospitals, medical groups, federally qualified healthcare clinics. We offer a full range of services as well as a suite of products designed to increase efficiency and facilitate communication. We've been in business since 1999. We work as a partner with NextGen since 2001. We have clients all over the United States. We're EHR agnostic, and we have services and products for healthcare providers. If you want to follow us, you can go to your favorite social media platform, Facebook, Instagram, Twitter, LinkedIn, and you can even subscribe to our YouTube channel. Just search for EMT Apps. About our presenter, I am so pleased to welcome Michael Cayton to our webinar today. Michael is the CIO of the California FQHC Community Medical Centers, which is located in Stockton, California. CMC is a network of 24 healthcare centers that continues to expand, serving patients in San Joaquin, Solano, and Yolo counties in California. He has been with the organization already 2 years. Previously, Michael was a division CIO at Kaiser Permanente and has extensive experience working across various verticals supporting information technology functions, including financial services, government, and logistics. He's also worked at well-known companies such as Amazon, Expedia, Wells Fargo, and Bank of America. CMC is one of the largest safety net providers in California, employing 900 FTEs. And the FQHC is a federally qualified healthcare center and certified by the Joint Commission as a primary care medical home. Michael runs and oversees the operation of CMC's IT department and is directly responsible for the implementation of key technology systems used by the organization. As the COVID-19 breakout continues to spread across the country, IT leaders like Michael have realized that they need to shift their strategic priorities to not only help their organizations and clinicians handle the pandemic, but figure out how they will continue to lead and operate as a successful CIO and FQHC in the future. Next slide. Michael's story begins the week of March 17th, 2020, when the stay-at-home order was announced by the governor of the state of California. He's going to discuss how he was able to utilize technology to deliver quality results and talk about what he anticipates his organization is going to be like in a post-pandemic world. With that, Michael, turning it over. Thank you.
Thank you very much. Good morning to those who are in the Pacific Standard Time Zone. Good afternoon to those who are in the Central Time Zone and the Eastern Time Zones. Thank you for taking the time to join. Cheryl and the EMT Apps team, I want to thank you all very much for this opportunity to share with your customers and other of my partners across industry, talking about how we as a company responded to COVID-19. So as you see on the slide, March 17 was the first week of the pandemic. You can go ahead and go to the next slide. Just to give a little context, we actually started talking about this in our organization back in late February. We kind of started reading the tea leaves. And so our CEO in her wisdom pulled us together in advance and said, hey, what are we going to do to deal with this, because it's coming? And so what that meant is that in the early days, I had to take an immediate inventory of the resources. How many laptops did I have, desktops, software licenses for Zoom and WebEx, which is Cisco technology. And then we had to get an idea of how many people we were going to have to move to a remote work construct, something that many had never done before. So this meant adjusted workflows. In day two, after we had situated everyone with laptops, desktops, monitors, cameras, cell phones, etc., we started taking telephonic visits because we were not allowing patients to come into the clinics. We didn't know, how many patients were potentially affected. The technologies that we use NextGen, that's our EHR. We were piloting their auto product. We're using Doximity. We're using WebEx. DoxyMe is another product that we used. And then we've been introduced to some new technologies since then. We did not have to close any primary care clinics. We did eventually have to shut down our dental clinics. And in terms of impact to our staff across this entire experience, we've only had to lay off a total of 10 full-time employees. We did do some furloughs in our dental area and other non-essential areas, but that was really the extent of it. Next slide, please. So we made some adjustments to our administrative and clerical functions, and our front office staff office were reduced because we didn't have people coming into the clinics. Obviously, there was reduced need for receptionists and those kinds of things. Our leadership team, which is comprised of 33 individuals, including the executive team, of which I'm a part of, which is comprised of a total of 6, so a total of 33 of us. We took voluntary pay cuts to the tune of 10%. We had to live with patient visits to our clinics declining by as much as 30%. Our call center did stay open because we needed to do a significant amount of outreach very quickly to our patients to repurpose their in-person visits to telephonic visits. Next slide, please. So, the questions, what tech products were needed for remote work? Well, you needed a good quality video client. So in this case, it was either Zoom or Cisco's WebEx. We had to do very rapidly a review and revision of workflows to deal with what was the new normal. And then, of course, we had to make some staffing decisions in terms of where we were going to place staff, what staff were going to be best at certain locations. We had to look at staff in terms of their affinity for technology, their level of comfort dealing with technology, and then where was staff going to be? Were staff going to be working in clinic? Were they going to be working remotely? Because we didn't kill off all in-person visits. We simply reduced those to emergent situations. Next slide, please.
Michael, can I ask a question for you?
Absolutely.
So what were the unique remote challenges that can be mitigated in the future?
I think the unique remote challenges is really having a pretty good feel for who on your staff is technology savvy, those who are not afraid to try new things. I think that's one. I think the other is making sure that you have sufficient levels of technology resource, that you've got enough laptops, that you've got webcams, that you have monitors that are webcam enabled, the camera comes integrated. Those kinds of things certainly right off the top. And then trying to make your workflows more flexible so that they take into account what could be a permanent situation relative to certain types of work being done remotely.
Got it. Thank you.
Certainly. So successes since the pandemic began. You can go ahead and go to the next slide. So we were able to pivot, very rapidly for an organization, of our size. While we're certainly not a Kaiser Permanente or Sutter Health or any of the other large healthcare systems that you might find in your respective geographies, to take any organization that is more than 20 people and pivot to a totally different way of doing business in a very short window of time. And in our case, it was 72 hours. We were able to move into telephonic visits, which was really a revenue saver for us. And we also had to do some things relative to our billing. So we had to work very closely with our finance teams, our billing managers, to make sure that the appropriate coding changes were put in place. And then staying on top of the coding so that we could bill immediately, because again, not only were we trying to take care of patients, but we were also trying to make sure that the business remained viable, because the impact to our communities would have been significant if we had not managed appropriately. Our chief medical officer guided providers in knowing what to do, how to accomplish the visits, the workflow changes. He and our chief nursing officer did a lot of proactive communication, in some cases several times a day, to bring everyone on board and at least get us moving in the same direction as an organization. The next slide, please. So our providers started taking the telephonic calls by the third day. We did not restrict the technology. So some of our providers have iPhones, some providers had Android phones. For those providers that had iPhones and patients that had iPhones, in some cases we were doing a FaceTime, using FaceTime technology. In other cases, we were using Duo technology, which is a product made by Google. In some cases, it was the Zoom client. In some cases, it was a DoxyMe client or a Doximity. I mean, we were very, very, very flexible because the circumstance dictated that. Our executive leadership support was without ego. People set aside agendas that were not compatible to what we were trying to get done. And that allowed us to be extremely nimble in our decision-making process. Next slide, please. So one of the other things that we get to crow about as an organization is the fact that we have a data analytics team, and right now it's comprised of about 4 individuals. We're looking to grow that team, but that team really put their shoulders to the wheel, and they cranked out a number of timely informational reports. What did our daily visits look like? How did visits look, post-pandemic versus pre-pandemic? Visit breakdowns about how many in-person versus how many telephonic versus how many video. I mean, all of that kind of stuff, the breakdown and the trends. And the other successes that our no-show visits decreased by about 50% because of the outreach. Now, we already had some other tools in place. We have a product called Well App that we use for outreach, and working very closely with our patient services center, our call center, to outreach to patients and then reposition them to different types of visits versus in person. Next slide, please. We're continuing with our telehealth model, and we're going to continue to expand remote work across our organization. The other success that we got out of this is faster turnaround for decisions as it relates to tech product selection and deployment, because we were almost in a situation where our backs were almost completely against the wall. We had to make some decisions very, 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 very quickly. And so we had to deprecate certain processes. So for example, governance process, where we usually take things through for full vetting, discussing pros and cons, cost benefit analysis, return on investment calculations, those kinds of things. We had to waive those processes so that we could get technology in place quickly, so that we could continue to take care of the patients and continue to sustain the business. Next slide. So financial challenges. So before I go there, are there any questions I can answer at this point? Does anybody have any questions?
I don't have anything new. Let me ask you this. It sounds like your offices remained open. So how did the in-office visits change? What was the new process?
So the new process was, the first question was it an emergency kind of situation, right? Something where you really needed to get in and see the physician. Maybe it wasn't 911 emergent, but it still warranted an in-person. And so we provided guidance to our call center in terms of a new script, in terms of what to ask patients. And then if it was determined that patient needed to come in, then we did temperature checks. We insisted on mask, and we made no allowances for not having a mask. If the patient didn't have a mask, we had sufficient amount of mask available that we could provide a patient. We also would ask the patients to remain in their vehicle until it was time for the actual appointment, so as to reduce the amount of traffic and congestion in our lobbies. We also remove chairs from our lobbies in certain instances, or if we had a smaller location, because we have taken into account that some of our patients mobility challenges, physical mobility challenges, and so in some instances we removed some chairs, but not all, because we have 24 different locations spread across 3 different counties. Community needs, population stratification is different, and so we had to take it on a case-by-case basis for each location. But by and large, patients stayed outside, masks were required, temperature checks accomplished, and making sure that if a patient needed to be seen, we made provisions for them. But in most cases, we were able to convert them to a telephonic or a video visit.
Okay, I have another question for you. So the pandemic caught most orgs a little off guard, but the crisis was also punctuated by social unrest. Did the organization take a public stance on social inequities as it applies to marginalized communities and access to care?
Excellent question, and I am very proud to say that yes, we did. We put out a public statement that was published in the local newspapers in the major cities in which we do business. There was a very, very clear statement about our support, full-throated support of the Black Lives Matters movement. And so, of course, I think for reasons that would be obvious to our audience, I was quite pleased about that leadership. And this was very passionate and very well thought out a statement that our CEO put together. And then there was a significant amount of outreach done in partnership with across the community, reaching out to the NAACP, reaching out to La Raza, reaching out to the various chambers of commerce that supported the represented communities, minority communities in our various counties in which we do business. So yes, very, very, very strong statements put out and communicated through our social media platforms as well.
Michael, would you be able to share a link maybe when we send back the presentation with answers to the questions?
I think I would be able to do that. I'll work with our communications professional and share that information.
Awesome. Thank you very much.
Mm-hmm.
Okay, you can continue.
Yep, we can go to the next slide. So, new financial reality, and this was across the board. There was not an FQHC that I'm aware of that was not impacted in some way, and not a positive impact. In our case, at the peak of the stay-at-home, we were losing $57,000 a day in revenue. Now let that sink in for a moment. $57,000 a day. We're open 6 days a week. Of course, we close on the traditional, holidays, Christmas, Thanksgiving, those kinds of things, but we're open by and large. So that was a significant hit, and we were able to weather that storm. Now, we are almost back to pre-pandemic revenue stream and patient visits. The difference is that our patient visits, and I'll talk about this a little bit more in terms of the distribution versus in-person, telephonic, and video. We had to upgrade certain portions of our IT infrastructure. I needed to make sure I had enough bandwidth. I needed to make sure that the infrastructure that I had, my routers and my switches and my firewalls, were all capable of handling increased traffic. I had to make sure that I dealt in a zero trust, because I'm in effect had to extend our corporate network to wherever our employees are. And we have employees that come to Stockton but live, a couple of counties away. We have employees that live, away from their primary office. We have employees that live in more remote areas. And so making sure that we were able to extend our network and also secure it at the same time brought along its set of challenges. Next slide, please. So we had to balance, working from home. With everybody's schools being shut down, and we have a number of working mothers, working parents in our employ, and now they are having to go home, try to work, and manage, the children that would otherwise be at school or in daycare, those kinds of things. So trying to balance those things out and being mindful of the financial impact to our employees, especially those that ask for reduced working hours and those kinds of things. And we were very, very, very flexible with that. One of the things that we did, and I'm most proud of as an organization, is we maintained benefits for our workers that were working less than 40 hours a week. And that's significant. A lot of FQHCs were not able to do so, or if they were, they chose not to do so. We chose to do what was right, what we thought was right as an organization to maintain, to help our employees maintain balance, maintain appropriate equilibrium. Everybody's lives had been turned upside down as a result of COVID, and we didn't want to add an additional burden. Workers who were making more staying at home due to enhanced unemployment benefits. That was a challenge for our organization, as it has been for many other organizations. And in this particular case, where we had an employee that did not want to come back because they were making more staying at home, we simply referred them over to our HR department and let our HR department work through those challenges with those employees. Next slide, please. So I had to increase the amounts of money that I was spending. So, for our providers, because some of them were not in the office, we were providing them with 2-in-1 tablets or laptops, function both as a laptop and a tablet. Those devices cost about a factor of 2 more than my standard desktop unit. I had increased licensing costs and support costs for software licenses, so supporting Cisco WebEx, supporting the Zoom technology products, and then thinking about how to add more staff to the business in a strategic manner. While we furloughed some, we laid some off, but the business still had to go. And as a result of the changes in our business, many of them driven by the remote work, new support model. How do I support remote workers from an IT perspective? Because I can't go and put hands on a desk per se. And so did I need increased licenses or technology spend for support of them? And then, what were the priorities? What are our financial priorities given the fluid nature of the pandemic? Where were we going to spend money? Where were we not going to spend money? Those kinds of things. Next slide. So the impact of the pandemic. What is the next iteration of our footprint? We can go ahead and go to the next slide. So the next iteration is a lot more technologies in the cloud. We're working very rapidly towards moving standard business workloads like telephone, like desktop to the cloud. EHR, we're going to be more circumspect. We will continue to look at options to host our EHR in the cloud, but we're going to be very deliberate about that. We have a number of infrastructure upgrades and swap outs. We accomplished pre-pandemic. We had refreshed all of our desktops across the entire organization, getting them to Windows 10, et cetera, upgrading our on-prem hardware stack that our next gen product runs and resides on, and then all of the ancillary support products that were needed around that, increased network bandwidth, making sure that we have, data resiliency, circuit resiliency, a more full meshing of our network, next gen application upgrade, and then of course the expansion of our data analytics. Next slide.
I have a couple of questions for you, Michael.
Sure.
So far as the bringing all of the equipment up, did you have to do anything different with security because of the telehealth and the use of the phones?
So we are a two-factor authentication shop, as most shops are or should be now. So we didn't have to do a whole lot there. What we did do is go back and make sure that we went back and we did an assessment of what our existing processes and protocols were, and would they be sufficient given the expansion of remote work. The other thing that we had to do, though, is that we had some employees who had good technology at home. And so in that instance, it was making sure that they had a compatible or equally functioning antivirus product on their individual workstations. And then in some cases where there were not workstations, we also issued cell phones, Apple iPhones, which are pretty secure devices comparatively speaking. But it was really more an assessment to look at where we are from a compliance perspective and where we were /are with our current security processes to make sure that we were good. And fortunately, we were good. I'm kind of paranoid about that because in addition to being the CIO, I'm also the CISO for our company.
Okay, and I have another question a little bit along that line, but more with your staff. So we did have to deal with staff shortages due to demographic limitations. Did your organization have staff shortages, and how was the issue handled if intra or interstate travel for workers was paralyzed?
Well, we didn't have any out-of-state travel, so we didn't have to worry about that. Our travel is generally county to county. Did we have staffing challenges? Absolutely. We continue to deal with those because people are still fearful, and especially here in the Central Valley of California and Stockton specifically, there's been a request from the powers that be, not our organization, but our political leadership in the county and the city level to ask for federal resources to come in and help with the surge that we're experiencing here. And so, at the early stages, we had people that, particularly in our call center space, and even some of our medical providers, doctors and nurses, who were like, I just don't want to deal with this COVID thing. So we would do a warm handoff over to HR, and then we would basically reshuffle and find providers that maybe didn't have a full panel, and we would ask them to fill in to other locations. Now, the thing that we would do when we would ask them to fill in is we would ask them to fill in from a remote perspective. So that meant converting any in-person visits to a telephonic visit or video visit, and then repaneling or repurposing or reassigning the patient to the new provider for any upcoming appointments.
All right, thank you.
Certainly. So what else did we do? Back to our slides. So I increased, go back one, please. So I increased our bandwidth with AT&T. We're piloting 2 products in our call center to enhance and increase the capabilities of our call center. Building out new technical infrastructure. We're moving to software-defined wide area networking, which gives us, in the future, gives us the ability to spin up new offices and new practices in a matter of minutes, hours at the outside window versus days in the past. We are decreasing physical office space for any new construction, so our lobbies won't be as large, but we will repurpose some of that space to more rooms that would support telephonic visits and video visits for our patients. And then, of course, getting back to our pre-COVID financial numbers. Next slide. So, we're reviewing all capital projects now in terms of the amount of square footage that was projected, looking to see if we can cut square footage where we can, where it doesn't make sense. Early projections do show that we have opportunities to save millions of dollars because of the changes in footprint. So that means Exam rooms will be, the same size, but lobbies will be smaller, so we won't have as much lobby space. We will have the ability to add more exam rooms. So say you cut, several hundred square feet off of a lobby, you can repurpose that space into exam rooms and then put the appropriate technology in that would allow for video and telephonic visits. And the reality is sunk in with our leadership team all across the organization that not everybody has to be in the office to do the work. And some people can work very productively from home. And for those that can, we've seen an increased morale and improvement in that particular space. Next slide, please.
Michael, do you have any enticements that you guys are giving to your employees to get them back in?
Not at present, except for you want to keep your job, come on back to work.
That works too.
But no specialized incentives at this point. Now we are being very, very, very flexible, and we're doing some hard assessments. And when I say hard, not in terms of difficulty, but just doing a real deep dive on the types of roles that have traditionally been in the office and saying, you know what, that's a position that really could work remotely. And then wrapping around the appropriate policy and procedures and guidelines, HR guidance and guidelines to the leaders so that they can make the appropriate assessments for their employees. But no other incentives beyond, hey, you still got a job, we still want you here, come on back, we'd love to see you. Pointing back to the slide, new work guidelines supporting long-term remote work, facility disinfection driven by our facilities infection control teams. We're trying to push the boundaries of innovation. So, we're looking at all kinds of different things. For example, now we're looking at putting together what we'll call a mobile wow cart, right? So it's basically a cart that's equipped with a current model laptop. The laptops have cameras. We're also adding a camera-enabled monitor to those carts so that the providers can go from room to room very, very, very quickly, everything consolidated with as little friction as possible, and deal with multiple patients without having to cart something under their arm, those kinds of things, right? Telework and video visits is here to stay. And we're looking at other things like how do we digitize and leverage email systems for all of the various forms and so forth that our patients have to fill out, and getting that stuff out to them prior to visits so that when they come in, all they really have to do is come in for the visit, and they don't have to spend a lot of time dealing with paperwork. This has been very much a change management exercise in every sense of the word, and we all know that change is extremely difficult, even in the best of times, even for the most flexible and open-minded persons. That being said, one of the keys here is to communicate often. Tell your employee base what you don't know or what you haven't given consideration to. Encourage your employee base to give you all of the unadulterated, pure, unfiltered feedback about anything that they're seeing or feeling, or ideas that they would have to make it easier to get the work done and to take care of the patients in the most efficient, caring, compassionate manner that we can. And you've got to be open. You've got to be open to change, and you've got to be extremely flexible in times like these, because you don't know what the next day is going to bring. And so you have to be flexible. You have to be at least willing to turn on a dime, even if your current capabilities are not where you would want them to be, that would allow you to, but the willingness is there. And as long as there's a willing heart, there's a lot that you can get done. The next slide, please. So we're going to continue to improve our tools. I'm going to be looking more and more and more at what we can automate, repetitive, repeatable processes. I'm going to unleash technology on those to free up our people to be more focused on the not the busy work stuff, but the higher types of work that they're capable of doing in terms of their thinking and creativity. And so we're going to do a lot more of that. We are issuing as many devices as we possibly can to make sure that people have all of the tools that they need to work from home or work remotely. In some cases, some of our laptops are cellular enabled. We are generally keeping those for our providers and other key members of the leadership teams, people who have a tendency to be out and about more, even in the pandemic. We are still visiting our clinics. We're still touching bases with our people in the field and those kinds of things. And then, of course, increased access to care, leveraging video and telephone, and making sure that, you know, we can bill for as many encounters as we possibly can. We figured out, we have learned that we don't have to sacrifice patient care, you know, at the altar of cash flow. We can preserve cash flow, we can enhance revenue, we can increase our operating efficiencies, we can improve our functioning as a business, and continue to provide or improve the quality of care. And now we're able to tell the story in terms of the quality pieces because our data analytics team is up and operating, and they're going like gangbusters. And so, you know, we can take great care of our patients. We take great care of the business. Our board is happy. Our communities are happy. Our patients are healthier. And so it becomes a win-win. Any questions?
Yeah, I have a couple for you. Okay, so did you guys have any check-in kiosks? And if you did, are you still going to use those moving forward, or?
No, that is the next frontier in our lobby environments, even though they will be smaller. And I actually want to go even a step further and actually create a mobile application that we can share with our patients, that they can put on their mobile device, that would handle check-in and all of those kinds of things, you know, in a much more advanced fashion. But we haven't gotten to the kiosk as of yet. Kiosks have been here. They predate my arrival to the organization, but they were deprioritized in favor of some other activities, again, prior to my arrival to the organization. But there is significant interest in kiosk and more of a concierge type of experience, red carpet kind of experience for our patients when they do have a need to come into our facilities.
Okay. And then you talked a little bit about money, and the money that you guys got from the federal or the state, was that in the form of grants, and how quick did you get it?
We got a lot of money from state and feds, millions of dollars. I don't know what that final tally is. And the money showed up pretty quick. And as a result of that, I was able to go out and order, you know, any additional equipment that I would need, you know, at least get it out of our door. The long pole in the tent was going to be availability of product in the supply chain because of the reduced manufacturing capacity, you know, overseas, particularly coming out of China. And so trying to identify enough product in the supply chain has been the bigger challenge than it is having the money to purchase equipment and needed supplies. But most of the money that we received came in the form of grants, and that has allowed us a greater level of flexibility in terms of meeting the challenges of COVID-19.
Okay, another question has come in. How do you manage patients who don't have or can't afford the technology?
Well, we have a number of patients that have older cell phones, flip phones, those kinds of things. And so in those particular instances, many of those phones can still receive text messages, and that's where our Well app application comes into play. But for those patients that don't have, you know, the most advanced technology, our call centers are still making telephone calls to, you know, the designated number that they have on file. So we're still talking to people, you know, over the telephone in a traditional manner. But a number of our patients who one generation is monolingual, but the younger generation who often will accompany that individual to an appointment is bilingual and generally has newer technology. And so we work very closely with those caregivers that are assisting their older or more frail members that are our patients, and working very closely with them to handle the communication needs to make sure that communications get to the right people at the right time. But we have not deprecated, quote, old school communication standards in terms of reaching out, and our patients still get a fair amount of information through the mail from us about what they need to do relative to appointments, follow-ups, and those kinds of things.
All righty. Does anybody have any other questions they'd like to submit in the box? I don't see any new ones coming in. Well, let me ask you this, Michael. Can you tell us what you would do different?
Yes, I would find out who my people are across my organization. Who my tech champions are, who my stealth tech champions are. Who are those individuals who are not afraid to kind of jump into the deep end of the pool, both feet first, and go for a nice chilly swim, and bring them on, because they will help to evangelize the new technologies that we're looking at, the new processes and procedures that we're looking at. The other thing that I would do is I would move faster in terms of trying to lock down product, hardware inventory, and those kinds of things. I would have moved a little bit faster, but it was really kind of murky, and you were getting different, or I was getting different input and feedback from various vendors. This vendor says, yeah, we got plenty in the supply chain. This vendor says, oh, it's kind of sketchy. Vendor X, vendor Y will say it's somewhere in between. So trying to nail those things down a little quicker. And the other thing is I would have brought on more, I would have done more staff augmentation on the tech support side to cut down on the long hours that my teams had to put in to deploy, remote work constructs, across 3 counties. And I think the other thing, one of the things that I will do going forward is I'm going to set up a depot level cache of inventory at major locations in my 3 counties, so that if I run into, or our end users run into an equipment malfunction, things don't have to be shipped from corporate headquarters here in Stockton, but they could basically go to a hub in the county where they are and get what they need same day. It might be a trip across town, 15, 20-minute ride, even a 30-minute ride to get that new piece of equipment, but you still get that productivity back because you lose 2 hours versus losing half day or whole day of productivity because you lost a computer or a webcam or some other computing device that you need to do your job.
Got it. Anybody else?
Going once.
All right. Well, any further advice, Michael, you could give to anybody regarding the whole situation?
I would say be extremely flexible. Understand that you don't know what you don't know. Humility goes a long way in situations like this because there is a lot to be learned. Be quick to listen. Very, very, very quick to listen. Listen to your employee base. Listen to the anecdotal information. Pay attention to the news cycles as it relates to COVID. Pay attention to what the medical professionals are telling you. Lean heavily on your data, but make sure that your data is accurate and make sure that your data is timely. Bond closely with your vendors. Get your hardware inventory ratios up, and then push remote work as much as you possibly can. Work hard to win over the hearts and minds of the skeptics relative to remote work, and then work closely with your HR teams to set up the appropriate assessments, because the reality is not everyone can be productive from home, even if they don't have distractions. Some people simply work better in the office construct. And so knowing who those people are, what their strengths and weaknesses are, I think are all things that would be appropriate. And then lastly, just keep an upbeat attitude. Know this for sure, that in the midst of, all things breaking loose, that it will change. If you can hold out, hold on, and not give out, you'll come out on the other side of this thing, and you'll come out fine. Your organization will be stronger, your people will be better, and you will know who is absolutely committed, regardless of what may come, to your patients and their care. And this has given us a lot of that insight about our employee base. And I'm proud to say that the vast majority of our employees, I'd say better than 90% of our employees, are looking to come back to work and want to do good work and are still committed to the mission. So that's what I have. Are there any other questions? Well, I don't hear any, but if someone is talking, I can't hear you any longer.
Yeah, there hadn't been any more questions submitted, so I
Okay.
guess we can wrap it up.
All right. Well, any questions from anybody on the EMT app side, particularly those of you who helped to put this activity together? Is there anything that I can answer that you haven't already asked? Anything that comes to mind?
I've got a thank you from one of our attendees. Thank you. It was a great presentation and chocked full of information. And I can chime that in from the EMT Apps side as well. We thank you very much, Michael. It's definitely been lots of knowledge from the other side that we don't necessarily get to see firsthand. So thank you very much for your input and presentation.
Well, thank you all for having me. Thank you all for extending the opportunity. And if there's anything that I can do to help EMT Apps or any of your customers going forward, Cheryl knows how to get in touch with me. I share my contact information freely. And Cheryl, you have my blessing to share, with any of your customers. They can reach out to me directly if necessary, if they need to. And I'm always happy to help. So again, thank you all very much for this wonderful opportunity, and stay healthy. Mask up. It's not political, it's a health thing. And let's get through this thing together, and hopefully, in the very near future, we'll be able to look back on this thing and say, hey, we made it through. We learned a lot, and we're a lot smarter and a lot better as a result, both at a personal level, at a business level, and at a healthcare access level.
Well, thank you, Michael.
Thank you all very much. You all have a wonderful, wonderful remainder of your day.
And everyone, remember, you will be getting an email with the recording and the presentation. We'll have the questions with some answers in there as well. If you need anything or have further questions, just reach back out to your sales rep, and we'll take care of it for you.
All right. Thank you all very much.
Everyone have a great day.
Take care.